joining us. This is the second meeting that we've had concerning our reopening. And we just think it's important to always be in touch and to keep you updated with the latest information that we have regarding our schools reopening. I want to start by introducing the panelists for tonight. We have Ms. Wendy Edwards, she's our executive director. Pamela Falcon, who's our Director of Curriculum and Instruction and Pre-K programs.
Good evening.
Lakia Edwards. I was getting ready to call her something else. Lakia Edwards, our Director of K and 1 programs and reading instruction.
Me.
Amia Johnson is the Director of second and third grade programs and our math instruction.
Evening.
Tiffany Johnson is our special education coordinator.
Hi, everyone.
So we're going to use a PowerPoint tonight for visual guidance through our conversation this evening. I encourage you to place any questions or concerns that you have in the chat box feature at the bottom of the screen. We'll be answering your questions throughout the discussion, as well as at the end of the discussion, we'll try to wrap up with responding to any of the questions that you guys might have. So our meeting agenda tonight is as follows. We're going to talk about the ABV model. That's the schedule that we're going to use for the reopening of our school, and I'll give you much more information about that. I'm going to provide you with updates. You'll hear about academics and instruction, and the meat of this meeting tonight will be on health and safety. So we just want to make sure that we apprise you of our plans for a safe and productive start of our school year, so that all of our families, our children, and our staff are all safe. So I will present this first part, and again, it's the ABV model, and let's talk about the guiding principles for schedule development. So we use a set of guiding principles for our to develop this. I don't know why it's not. Can you click one more time? There it is. No, back. Okay, so we use some guiding principles to come up with our schedule. Of course, safety was the major factor that we looked at because that's our number one priority. Family choice and perspective was also considered. Many of you responded to the survey that was sent out to families in the District of Columbia, and so we were meeting with the Deputy Mayor of Education, along with other leaders in the educational community in DC. And we looked at the data that you guys provided in your responses to that survey and considered those in coming up with the schedule that we are proposing. Quality instruction for all students, of course, that is a factor. We want to make sure that our students, whether they're learning at home or at school, that they're being provided with quality instruction. We wanted to maximize the in-person learning opportunities with the restrictions that we have and the guidance that we have from the CDC, as well as the Department of Health in the District of Columbia. There are certain guidelines that we have to follow, and so you will see how that's going to affect how we provide services to your children. But we wanted to, in that, maximize our in-person learning opportunities. And then, lastly, we wanted to consider the citywide alignment and coordination. Many of you probably have children in other schools or maybe other school districts, including DC Public Schools, where there is talk about how they're going to be providing instruction and the amount of days that kids will be asked to report to school. And so we wanted to make sure that we were aligned with other schools around the district so that it makes it easier for families to enroll their children. And so And schedules would be aligned. Your family schedule would be aligned if your child is, for example, at ECA for a certain days of the week, and then if they are at another LEA, it can be aligned with the days that they are in school with us. So those are the things we considered. And next slide.
So, Mr. Ingham, before you move forward, if I could just ask, because I know a lot of questions are going to rise, and someone has already raised their hand. If you could just type your question in the chat box, and then when we finish the presentation, we'll try to go through every question and hopefully have the answers. And perhaps the question might be answered as we go through this presentation. So just type it in the chat box, and we will get to it at the end.
So here's the learning schedule that we are embracing. I can tell you that tomorrow there will be a press conference with the mayor of DC, who's going to make some announcements about DC public schools. And just know that we are a school that wants to make sure that our schedule is aligned with most of the schools in the districts. That includes DC public schools. And while we are suggesting this schedule, be open to the possibility of this changing for us. But here's what we have so far. We are proposing an AB blended cohort, which means that each child would come to school 2 days in person and 3 days they would participate remotely. And then we have the V, which is the the virtual learning, which some of you parents have already indicated that you want 100% of virtual learning for your child, and we are prepared um, to provide that for families who choose to do that. So if you don't want your child to report to school in person, we certainly will have 100% virtual learning option available to those children. So let's look at cohort A. So students who are in cohort A would report to school on Monday and Tuesday, and then Wednesday, Thursday, and Friday would be days that they would receive remote instruction. Cohort B, remote instruction would be Monday through Wednesday, and then in person on Tuesday and Thursday. Then again, the virtual 100% virtual, of course, would be at home. I think some of this is going to be further clarified as we move through the presentation, especially regarding the health and safety concerns that we are addressing. And so I'm sure that if you have questions now, they will probably be addressed later on as we move forward. So the updates for you this evening are our school start date is Monday, August 31st. So we are planning on providing before and after care services um, for working families. Just to know that aftercare services will be made available for children who report to school in person only. And so it would be available for cohort A for Monday and Tuesday, and cohort B for Thursday and Friday. We will begin at 7 o'clock in the morning, as we have historically, and children can stay as late as 6 in the evening. We'll give you much more detail about the cost of before and after care. Of course, it's going to be greatly reduced because of the number of days that we will be providing that service to you. We're going to provide a virtual tour of our facility. What we'd like to do is to make sure that you parents are aware of the changes that we've made in the school building to adhere to some of the safe and healthy concerns that were raised. We want to show you the common areas of the building, classrooms. We want to share those with you. And so there will be a virtual tour that we will provide, and it will be available on our website, and also we'll post it on our YouTube channel. But we'll give you that update once we make that available. Parent orientation is going to happen on Wednesday, August 26th. And at that orientation, you will get much more detail about our policies and guidelines for your children at ECA, as well as uh, our programming and ways that you can support our school. Our parent survey is going to come out after this meeting. I believe we're prepared to send that out at some point this week. In that parent survey, you're going to be able to make your preference known for A cohort, B cohort, or if you want the 100% virtual learning option. And then finally, professional development for parents. What we'd like to do this year, because we know that you are supporting us in a very different way, you're also supporting your children in a way that we had not, expected you to in the past. We realize that we're going to need to provide you some support through that. And what we plan to do is have a monthly professional development for parents so that we can provide that support to you. And I'm going to turn it over to Pam Falcon, Amia Johnson, Lakia Edwards, Tiffany Johnson, and they'll address the academic component.
Good evening, parents, and thank you again for joining us. I'm going to be talking about the academics program. All of our students will be receiving the full complements of what we have to offer through instruction, as well as music and PE. Our pre-K teachers will be using the OWL reading series, which is called the Opening the World of Learning. It's a comprehensive program that goes over, that includes reading, math, science, and social studies, as well as focusing on the social emotional growth for pre-K students. And our kindergarten through third grade students the teachers will be compiling their lessons and using this as a resource for Reading Wonders and My Math. It's the McGraw-Hill series. And so they will also be following the Common Core standards, and that's how they'll be aligning their lessons. They will also use Houghton Mifflin for science and social studies, and all students again will be receiving music and PE by Mr. Chisada and Mr. Battle. And so if you have any questions about our academics program, please feel free to post them in the chat, and I'll definitely try to respond. I'm going to turn it over to Ms. Amia Johnson.
Hello, all. I want to chat with you just briefly about the digital programs or platforms that we will use. Everyone at ECA is very used to our class dojo. All of our teachers have used that to share and communicate and provide glimpses of what happens, on a day-to-day basis with our students. So we will continue to use that platform for communication purposes. Also, when we think about instruction, the two main platforms that we're going to introduce this coming school year is Nearpod and Google Classroom. These two platforms provide a much more engaging experience instead of the child just sitting and viewing an instruction, and we hope that this boosts engagement for the students. When we talk about the activities and assignments that students will partake in, IXL will primarily be used by our pre-K students in pre-K 3 and 4, and our kindergarten through third grade will participate in Moby Max. Both programs have reading, math, science, social studies, and other skills that they will be able to practice throughout the year. And particularly with literacy, we will continue to use our getepic.com app or site. If you are in need of internet access at home, we highly recommend Internet Essentials from Comcast. I put here that the cost is $9.95 per month, no contract, no credit check, because our students will need to have their own devices during the school hours of 8 to 3 and strong internet access. So if you are in search of a company for that, try out Internet Essentials. And finally, as Mr. Ingram stated, we will provide training for these platforms throughout the year, but we'll definitely start planning for that training in the very near future. So next we will hear about synchronous and asynchronous learning from Miss Lakia Edwards.
Hi, everybody. So I'm going to talk about synchronous and asynchronous learning. So I just wanted to talk very briefly about what those two terms mean. So when we talk about synchronous learning, we're talking about learning that is happening at the same time for our students, where the instructor is present and students are able to participate with the instructor and other students at the same time. An example of that is when your students are on Zoom and the teacher is giving a live lesson and everybody's able to participate together. It can happen on or offline. Asynchronous learning is learning that doesn't necessarily happen at the same time. An example of that would be if a teacher has recorded a lesson, kind of like what you get on Dojo. A teacher has recorded a lesson and you can kind of, at your own pace, have access to that lesson. And it's the opposite of synchronous learning, in that you will not be able to have immediate access to the teacher and be able to ask questions and get an immediate response. The next slide. So what are the benefits of synchronous learning? The benefits of synchronous learning are just that you have immediate access to the instructor. There's interaction between the participants, meaning that the students are able to participate with each other. They're able to participate with the instructor. Questions can be asked and answered right away. The exchange of knowledge and experience between the participants is happening in real time together, live, and you can get real-time feedback for the instructor. Our expectations moving forward with our new distance learning program for those students who will be having, or who have chosen, for those parents who have chosen to participate in 100% distance learning, is that we are expecting that our students are participating with the distance learning daily and that they have to be present for synchronous learning. What that means is if class is taking place at 8:30, then we are expecting for our students to be logged on and present in order for us to be able to take their attendance and be present and participate in those lessons. It is not going to be acceptable moving forward if our students who are participating in distance learning are not present when the lesson is taking place live. So we're going to be taking our attendance that way, and there'll be no exceptions for that. That's going to be a must. So again, if your child is participating in distance learning, we want to make sure that you are aware of the fact that they need to be online and present as the instruction is taking place live. If you have any questions about that, you can put them down in the chat and I will answer your question.
Our special education students will also be receiving synchronous and asynchronous learning with their special education teacher if they have an IEP. Also, if they receive related services through an IEP, such as occupational therapy, speech therapy, or behavior support services, they will receive these services remotely via a video chat platform, whether that be Zoom, Google Meet, or Skype.
Okay, we're going to switch gears and talk about health and safety. Is that next?
Yes, that's it. That's next. Yes.
But do we need to go to the chat box before we move on and make sure we're answering these questions so they don't mount up?
Yeah, the questions that we can answer where you are not going to be addressing in the health and safety, I think we should probably answer those. I saw that Ms. Johnson had already started to respond to some of the questions. Someone asked, will before and after care be free? It's not going to be free, but it will cost far less, of course, than what we've charged in previous years. I can tell you that ECA probably has the lowest rate for aftercare in the city. I can tell you that. And so we expect that that's going to be even lower because of our schedule. Um, if you have questions about choosing A or B option, I see some questions here about whether or not you can, choose that. That's going to be a part of the survey that you will receive. And so after this meeting, at some point this week, you're going to be receiving a survey where you can make that request known. And in there, you can say A or B, or you can say 100% virtual learning. Are parents allowed to rotate their student learning schedule? The answer is no. Once you choose A, we're going to expect that your child will be a part of that A cohort. There may be some changes in the city regarding the COVID-19 guidelines. Of course, they're changing as we speak right now. I don't anticipate it changing, however, to a place where we will be back to 100% in-person participation. But we are going to need to pay attention to those guidelines, and we may have to make some changes even to what it is that we're proposing now. But what we would like to do is take a look at it mid-year, any changes that we might need to make for, cohorts. So, for example, if somebody has chosen 100% virtual learning and mid-year you're thinking of having your child participate in one of the cohorts, that's the place where we'll have those conversations. But again, that's going to have to be guided by the health and safety situation at that time. So what's the student to teacher ratio? I think Edwards is going to address that. Yeah, so let's move forward with you, Edwards. I think everything else you will address in your.
Okay, and we can come back to anything that's not answered by the end of this presentation. So I'm going to talk specifically about the health and safety policies and resources that we have already planned at ECA in particular. And just want you to know that that is our biggest concern, as I'm sure it is yours. We want our kids to come back to school, but we want them to come back safely. And we want to ensure that we have as many things in place as we possibly can to just ensure that everyone has a safe and healthy school year. So I have in big bold letters, no exceptions. And what that means is when we implement these health and safety rules and procedures, this year we are going to mandate that they be followed by everyone. We at ECA have been very flexible in a lot of the policies that we have in place over the years. We understand things happen, parents have emergencies, and there's situations that sometimes parents can't avoid, and we try to be very flexible even though we do procedures. But because this is such a very, very serious situation in our city and our country and our world, we have to make sure that we are putting health and safety policies and procedures in place that we cannot deviate from. So as I walk through this PowerPoint, there are going to probably be things that you may take exception to, but I just want you to know that the reason why we have we plan to implement these policies is because we want to keep schools safe for your children, for our children. So, as Mr. Ingram said, some parents will opt to just have 100% distance learning or 100% virtual learning, and that's fine. You will get the survey. I believe you will get it. Will they get it tomorrow, Ms. Johnson? Ms. Johnson's on mute.
The plan is that the survey will go out directly after this meeting, and then we will continue to send it out. So you only have to fill it out one time after it does get sent out via email and through all of our other social media outlets.
Great. So just look out for that survey, because that's when you're going to have an opportunity to say, I want 100% distance learning, or I want my child to come on Mondays and Tuesdays, or I want my child to come on Thursdays and Fridays. And we're going to try as best we can to honor the days of the week that you want your child to come, if you want them to do the hybrid. And so, of course, as Mr. Ingram said, that would be 2 days on site in the school building, and then 3 days of distance learning at home. So the first thing that we are requiring of all of our staff is to get COVID-19 testing. They are to get it within a window of a month, starting July 10th through August 10th, and that's when the teachers come back. So this is not necessarily something that DC Health recommended, because what they said was, you can get tested on Monday and then be infected on Tuesday. So we know that. We know that testing only tells us our, state of infection or not at that moment. However, we thought it was important for you as parents, for our students, and for ourselves that we had just some baseline data so that we could say that this month before school began, our staff was COVID-19 free. So all of the staff has been informed they are going to have to get that done, and they're working on that now. This year will be very different. We are going to prohibit parents and guests and visitors from coming into the building unless it's absolutely necessary. The reason that we're doing that is because anytime someone else comes in the building, you are now adding another person who may or may not carry infection, and so that is another layer of concern for our students and for our staff. And so, before, parents were always in and out of the building. They would come and sit in the classroom and observe. They would have meetings with the parents. They would come and conduct all kinds of business. This year, we are not going to allow that. Parents are going to have, we encourage meetings with your teachers, meetings with the principal, but it will be done virtually. If there's business that you need to transact with the main office, we want it done virtually as much as possible. Sometimes you will have to come in, and of course, if you need to come in to submit something, certainly we'll have a protocol for you doing that. And arrival and dismissal will not be handled the way it was in past, where parents are allowed to come in the building and go to the classroom and pick up their children. So I'll talk about that a little bit more later on in this presentation. So we're going to have separate arrival and departure entry points for each grade level. And what that will do is minimize the risk of a big group of children and their parents standing or entering the building on the table. Fortunately, with this new building that we have about 7 exterior doors, 7 points of entry on the various levels of the building. And so there will be a sign like this one at the various doors showing where pre-K 3 comes in, pre-K 4, K, 1, 2, and 3, and they all will come in different doors. This is one of the no exceptions that I referenced at the beginning of this presentation, because we know that some parents have a pre-K 3 child and they also have a second grader. And so mom might say, I don't want to have to walk all the way around with my second grader. Can't the second grader just go in the door with the pre-K three because I've got to go to work? And so the answer this year will be no. We are not going to deviate. So if you have two or more children who attend ECA, you are going to have to walk each child to their entry door so that we will not have a mass of people coming in one entrance. That's for arrival. For dismissal, we will dismiss from the same door. There will be someone standing at the door. And as you come to the door, we will use our radios to call for the child. The child will come to the exit door, and the staff person who is standing at the door will make sure that the child is safely delivered into your hands. But you will not be able to come in the building as you did last year and walk to your child's classroom to pick up your child. Below this are all the entry doors. You don't have to worry about remembering this. We'll make sure we have all this information provided to you so you'll know where you need to go in the morning. We have purchased disinfectant mats, and they're just mats that you can actually pour disinfectant into. They're made to accommodate some kind of liquid, any kind of liquid disinfectant. But what we have been told was that it's recommended that as the children and staff come in the building, they wipe their feet on the mats, which gets any germs, viruses from the bottom of their shoes, and it traps less of that into our building. So that will be at every entrance point. All of our adults in the building must wear masks all of the time unless the staff person is alone in an office or alone in a space. But other than that, we are requiring all adults, all staff, all teachers, and if a parent does need to come in the building because of an emergency situation, he or she would have to have a mask on. Students, of course, it's a little trickier because we have children. It's hard for a 3-year-old. It was hard for me to wear a mask, so I know it's hard for our young children to wear masks. DC Health is saying that children above the age of 2 can wear masks, but they do recognize that for young children it's a little more difficult. So we're going to highly, highly encourage all of our children to wear masks. However, we do have children with asthma, other kinds of respiratory problems, and certainly if a mask is impeding their breathing, then they cannot wear it. We have purchased some masks for students, and I think there should be another color. This is one of them. If you would like to buy one for your child, we're selling them for $3. Just want to sell them for what we paid for them. But we do ask parents to be responsible for providing a mask for your child daily. Along with that, you're going to have to really help your child understand how to wear the mask to keep it clean throughout the day. This year, we're asking that students not bring backpacks to school. Our goal is to be completely paperless. Homework will be electronic. All communication will be electronic. The only thing that we know children will need to bring would be for the pre-K, they may need to bring their blanket at the beginning of the week. And children who want to bring their own lunch would, of course, bring that. But we prefer not to have backpacks at school, and we're not going to be giving children anything that would require them to put it in a backpack. So we'd like you not to send them with that this year. So in the morning, our plan is to use our no-touch forehead thermometers to take the temperatures of every student before they come in the building. Anyone with a temperature of 100.4 will not be permitted to come in the building on that day. That is for students and for the staff as well. So for that reason, that all parents remain with their child, or whatever adult is bringing the child to school must remain with the child, because if the child's temperature is taken and it's above 100.4, then the child needs to go back home, and it would make it much less complicated for us if the adult is still there with the child when that occurs. We are going to use markers in the hallways that will help the children know how to stand in a line if they have to stand in the line to move from one area to another, and they'll be 6 feet apart. So in the classrooms, what DC Health has indicated is that they started by saying we could have 10 people in the classroom, and then they revised their guidance and said we could have a maximum of 12 people with a 13th person who might come in periodically but not be there the entire time. And so because we have 2 teachers in all of our classrooms, we will have 10 students at one time that are permitted in the classroom, and it does not matter how big the space is. They have said 12 is the max. So for us, that would be 10 students and 2 teachers. The desks in the classroom are going to be arranged so that they are all facing the same way, and that is to keep children from, talking while facing one another, which, potentially could spread the virus more easily. Our custodians have already begun storing the carpets. We're not using carpets this year. The children will stay at their desks or tables and in their chairs. So we have purchased they're plastic screens. Hopefully you can see it in this photo. And we are going to put the screens on every student desk or table, and we're going to secure it using some type of Gorilla Tape so that it provides a little extra layer of protection, especially if a child sneezes or coughs, and we have young children, so they don't always remember to cover. But we feel this will greatly reduce the likelihood of spreading this virus through the air. And because our young children, are going to get tired of wearing the mask, they're going to pull on them, pull them off, put them back on. We felt this was the easiest and least invasive way to provide all-day protection in the classroom as students are taught. And so we just received that one prototype to just look at if it would serve our purposes, and I really do like it. And so we'll get the rest. We're supposed to have the rest delivered by the end of July. Obviously, we will keep those disinfected, and every child will have their own screen, not sharing the screens. We've bought enough so that every child will have his or her own. The mats for pre-K 3 and pre-K 4 will be labeled so that every child will use the same mat every day. As we always have done, we will sanitize them every day using disinfectant, and they will be stored in such a way that they will not be laying on top of one another like they are in this photo. So potty training. So for my pre-K 3 and pre-K 4 parents, it is really important, and I know there's not a lot of time left before school begins, but it is really important that you try as best you can to make sure your child is potty trained before the start of school. Obviously, having to clean up a child who has urinated on himself presents a little more danger this year than it has in the past. And so we really want to minimize those times when children need to be changed from soiled clothing. So I'm going to ask the pre-K 3 and pre-K 4 parents to please continue to work on that. Also, work on having the child tell you that he or she needs to use the toilet, and not just putting your child on the toilet, after a meal, because when they get to school, we want them to be able to say to the teacher that they have to use the toilet. For those of you who are new to our school, there is a toilet in every classroom. So the children do not have to leave the classroom to use the toilet. It becomes very easy for a pre-K 3 child just to go, but they have to feel comfortable telling the teacher that they need to use it. We purchased bins for every child that will be labeled, and the bins will go under the cubbies that typically hold the children's coats. In the bins, we are going to have that child's school supplies. So typically the children share crayons and they share pencils and they share scissors and glue sticks. We're not going to have them do that this year. This year, Leah will have her crayons and pencils, and Kevin will have his, and Dante will have his, and they will stay in the bin under their coat cubby. All of our meals will be eaten in the classroom, served in bag lunches. Breakfast and lunch will be eaten in the classroom. And yes, students may bring their own lunches, but please make sure that they understand they cannot share their lunches with their friends. We also are a junk-free school, so if you are packing a lunch for your child, we ask you do not pack candy and junk food. We want breakfast and lunch at school to be nutritious. So we have purchased these hats, and we purchased enough for every child to have his or her own. And what it is just one is a baseball cap, and one is looks like a little fisherman's cap with a plastic shield. We purchased these because we know our children are going to need breaks from sitting in a classroom with a mask on their face, and we want to give them opportunity to go outside, to breathe fresh air, to get some relief from that mask. And when we do that, we're going to give them these hats that will be labeled with their names, and they can put the hat on, take the mask off, and just kind of relax for a few minutes and breathe and have a little space and have a little air. And so the younger children will be getting the fisherman style, and then the older children will get the baseball cap style. The hats will remain at school; they don't go home. Unfortunately, we're not able to have any programs or any field trips because we are not able to gather in groups greater than 12. And so, we always have our fabulous winter program and our Black History program. This year, I don't know, we might try to find some kind of creative way to do something with the students, but it would not be the traditional program in the multipurpose room, and we will not have field trips. We have had a mechanical engineering company assess our HVAC system because we understand that can contribute to healthy air if you have a good system. Again, because our building is new, we have a good HVAC system. And what we have found out is that our system contains the airflow in the classroom. It doesn't move the air from one classroom to another. The reason that's important is because if there does happen to be one case of COVID-19 in one space, you don't want the air then moving all through the entire building. And it would not do that because our HVAC system does not circulate the air in that way. MERV 13 filters, and I'm learning all this stuff as I go along because I know nothing about mechanical engineering. But what I found out is that MERV 13 filters are the best filters to use in catching the particles that would be considered viruses that could cause COVID-19. And so we do have MERV 13 filters in our airflow handlers that will be changed. They're actually on the roof of the building. They're not the filters that are in the classrooms. They're the filters that handle the entire flow of air. And so they will be changed as directed. But those are, we're told, the best filters to have to improve your air quality. We'll continue our cleaning. We'll have our daytime crew, which will be our full-time custodians, and we'll have our evening crew, which we've always had. They will come in after the kids are gone. But this year, of course, we want them to pay strict attention to cleaning the bathrooms, cleaning the stair rails, the counters, doorknobs, and desk surfaces, all of those surfaces that are touched over and over and over throughout the day by children and by adults. So if a student becomes ill in the classroom for any reason, they will not be permitted to remain in the classroom. And we will have a waiting area where sick children can stay as we try to determine whether the parent needs to be called. When a child gets ill, we will move them from the classroom to a waiting room. We will contact the parent immediately, and if the child is showing symptoms that are consistent with COVID-19, and I know you guys know, you've heard all of that on the news, the fever, coughing, sore throat, just lethargic. Parents are going to be asked to pick up the child. And what I would really urge you to do, especially if you're a working parent, is to try as best you can to see if you can identify a trusted friend or relative who would be available to pick the child up immediately if you get a call from the school. The last thing that we want to happen is for a child to be sitting sick all day long as we contact a parent to pick him or her up. So this year, for any child that is sent home ill, and again, this is a different policy from years past, but for any child that is sent home ill, we are going to require a doctor's clearance for the child to return. Again, that's for the safety of everybody in the building. If you take your child to the doctor and in the doctor's evaluation, he or she says that your child should have a COVID-19 test, then we urge you to get the testing done. As my staff was getting tested, some of them were just really reluctant because they had been tested before, and initially the testing was involved this very long swab that went way down in the nasal passage and was really, really uncomfortable. They've come a little way since then, and now I was actually tested about 2 weeks ago, and it's a short swab, and they just run it around your nostril. It does not hurt at all. I don't know if all locations are using that, but I know that that is new, a new procedure that's out there that does not hurt and it's not invasive. So don't be concerned that, or ask your doctor what the test looks like for COVID-19 wherever your healthcare provider is. If the doctor recommends testing, if you have your child tested and the test comes back positive, it is critical that you contact the school, because we then need to contact DC Health, and there's a protocol that we are required to follow if one person, staff member, child, tests positive at the school. So many of our children have allergies and other chronic conditions that have absolutely nothing to do with COVID-19. But the problem is that a lot of the symptoms of allergies and other chronic conditions look very much like the symptoms of COVID-19. And it's often hard to tell whether a child just has bad allergies or perhaps has these symptoms that need to be looked at. So we're going to ask for doctors' clearances. So I don't want parents to be upset because you told us months ago that your child has allergies. We really do understand that. This is the problem. Even if your child has allergies, your child still could be susceptible to getting this virus. And so we don't want to just automatically exclude a child from further evaluation because that child has allergies. Because it could, in fact, be allergies and something else. So we are going to be asking for doctor's clearances. And if you take your child to the doctor and the doctor says, no, there's nothing wrong, just as allergies, then that is perfectly fine. We are not medical professionals, and we really need medical professionals to weigh in this year with any child who is presenting with any symptoms that look similar to COVID 19. Finally, and this is probably one of the most important things that I can say in this entire presentation, we have to be able to reach you at all times. And so I know sometimes you may change your phone number, you may even change your email address. It is really extremely important this year more than any other year that we are always able to reach you. So if your phone number changes, please let the main office know. I know a lot of you will reach out to your child's teacher and let him or her know, but it's very important that you let the main office know so that we change it in our database so that if something does happen and we need to call you, we're not scrambling to try to find out your correct phone number. Okay. I see we have like a lot of questions.
We do have questions. I want to try to get through as many as we can. And so I just saw a comment that they felt that there's a parent who felt like this was unnecessary because they thought that all of the learning should be happening remotely. And I respect that. And we certainly understand that that's going to be, many parents' position that schools should not be opening. I can tell you that many educational leaders, teachers, and everybody in the business of educating children feel the same way you do. But we do have a responsibility since we are opening school and making that an option for families. We have to make sure that families are very clear on what it is that we're going to provide. It also helps to inform your decision as parents on whether or not you want to send your child to school. There may be people on here, for example, who were totally thinking 100% distance learning, but based on what they've learned tonight, they might be considering, sending the child to school for the 2 days out of the week. That's up to you. But I just want to say that I respect your position on that, and no, you are not alone in that concern. There were some.
So let me just add, Mr. Ingham, that yeah, I see the comments, and so that's why we give you the option. That's exactly why we're giving you the option. If you want your child to have 5 days a week of distance learning, we are fully prepared to offer that to your child 5 days a week. It's still going to be a rigorous program. Your child will still have access to what is happening in the classroom because we're going to, as Ms. Lakia Edwards explained, we're going to provide synchronous learning so that while your child is at home, he or she will be online with the children who are in the classroom and the teacher. So, we understand that, and trust me when I say we have been pulling our hair out for the past several months trying to just figure out how to get this right. But if you feel like I don't want my child coming back, we are fully prepared to offer a full, rigorous program with your child remaining at home.
So there's a question here. I'm going to read the questions, and anybody can jump in and answer them. One question is, with virtual learning, I understand that the kids have to sign in for attendance, but is it any way we could have pre-recorded learning videos for parents who work during the school day?
So part of the reason why synchronous learning is so important is because it allows that interaction between the teacher and the child. And so we believe that without that, it's basically the same as just finding a good, learning channel on PBS and having the child watch it about letter sounds or about, numbers. What we want to make sure happens with synchronous learning, with distance learning, is that the child and the teacher are still able to talk. The child is still able to ask questions and get an answer. That there's interaction, and so that's why it's really critical that parents find a way to have their child participate in the synchronous learning portion of our day.
And I would encourage that parent who posed that question to contact us so that we can have further discussions, because I'd like to understand what's happening with your children while you're at work. Perhaps the person who is responsible for um, watching them could be support to them. What we're Some of what will be provided will be um, for children to log on for themselves, because after a while the children are going to learn to log on for themselves. They're going to learn how to navigate all of these tools, and so there won't be a whole lot of time where they're going to be needing adult assistance necessarily to navigate these systems as we move forward. One question, this is probably for Pam Falcon. How will you transition pre-K 3 students who are new to school environment? Usually pre-K 3 have bad first days. Oh my God, they do. Oh, when entering a new school environment.
You are absolutely right. It is always a rough start for our pre-K babies, as they, go through that separation anxiety, not knowing, going with a stranger. But I can assure you that we have staff who is well trained in working with students and providing them all of the social emotional support that they need. Think one thing that would be great is just to talk about the fact that they're going to be going to school, going to a new place, and just helping them to understand what's getting ready to happen. The more that they get comfortable, the more that you talk to them, they'll start to see that it's okay. They're going to cry. We also have parents who cry. It's okay. We're going to work it out and they're going to get through the day. The crying, most of the time, does not happen all day. It's kind of, the first 10, 15 minutes. And then usually right after nap, they wake up and realize they're still in the same place and they cry some more, but they're gonna have a great experience.
Um, Question, will water be provided in the classrooms? That way students don't have to share the water fountain. Water fountains will be shut down. There will be no water fountain use at ECA. And yes, water will be in the classroom. Um, have Has anyone tested the hats to make sure that they're safe for children?
Well, we pulled them out of the boxes they came in. In terms of testing them, no, I haven't put them on, but it's really just a normal hat, and it just has that shield on the front. And it's not. There's nothing sharp. There are no sharp edges or anything. So I can't think of any kind of hazard that it would pose. But if there's something in particular that you're concerned about, just drop another question in the chat.
How often will the building be cleaned?
All day, every day. So our custodian, we have custodians that work from 6:45 until about 5 in the evening, or actually later, and they will be cleaning throughout the day. We also are in the process of determining how we can kind of keep those bathrooms in the classrooms cleaned more regularly as the kids go back and forth to use them. And that's something, in all honesty, we haven't worked out yet, but that's on our short list to figure out, because we do think we need to keep those bathrooms, especially those toilets, very clean. And then in addition to that, we have a night crew that comes in and cleans the entire building.
So here's one question. It says an elevated temperature or fever is not the only symptom. A child could have other symptoms, and by infectious, and I think they mean and be infectious, or even asymptomatic. What is the plan?
Right. And so what the DC Health asks that we do is have parents just respond to a brief questionnaire at the door about any symptoms they may have observed their child having. And so we have to, of course, depend on parents to let us know if the child was coughing all night, because you're absolutely right. A child can actually be asymptomatic, as you said. The temperature screen is just one way we can at least rule out anybody that has a fever. But we're going to really have to depend on parents to be forthcoming about anything that's going on with their child as well, because you're correct.
Yes. So help me out, Ms. Johnson, Ms. Falcon. I may have, you guys have been responding to these, especially the chat feature. Are there questions that I need to pull from here that you have not responded to? I think some of the questions that I see were answered through Ms. Edwards' presentation. Um,
So I do see a bunch of questions. I don't know whether they've been answered or not. There's one about there was one, what would that look like for me if I'm a teacher myself, even when he's not in school for those 3 days? And we know that's a huge problem now because, as I'm sure you've heard, um, Prince George's County is 100% virtual now. Montgomery County is 100% virtual now. Charles County is 100% virtual now. So even for some of our teachers who don't live in the District of Columbia, we've got to really find out what their situation is going to be with their children. And so I know for many of you, when you've got to go back to work 5 days a week, and we're saying your child can only come 2 days a week, it becomes a tough situation that I wish I had an answer to. But honestly, I don't. I just know that we are adhering to the guidelines of DC Health, and that does not allow us to bring everybody back 5 days a week. We're just not permitted to do that safely. And so, we're always looking for answers to how we can help parents navigate this and still keep your jobs. It's just a hard situation with no good answers. Honestly, there's no like great solution. If there was a great solution, that person would be a millionaire right now because all the school districts all over the country would be buying it.
Another question, will there be laptops given for distance learning?
Yes. So we don't have the slides about the laptops. So we are encouraging parents to purchase laptops if you can, tablets if you can for your children, and we're going to provide you with some devices that we think would be best buys that are reasonable in price. But of course, we know everyone really can't fit that into their budget. And so we will reach out if you're saying, look, I just can't afford that right now, and make sure that you have a laptop that your child can use, because we need something your child can use exclusively. And if you have more than one child at ECA, we really need each child to have their own. So yes, we plan to support parents with that. We are going to ask parents, if you can, to please get your Wi-Fi connection if you haven't already gotten it.
So another question, will kids be required to wear uniform during virtual learning? The answer is no.
Yeah, I saw that question. Yeah, I don't. No, just if they can come out of their pajamas, that would be good.
Yeah,
So
I did answer that. That's exactly what I said. No pajamas.
Oh, you did answer that one?
Yeah.
Okay. So that's why I'm asking you guys to help me, because I might be pulling questions that you guys have already responded to. So are there any other questions that you guys can see that we need to pull from the Q&A or from the chat feature that we need to address right now that we haven't addressed so far?
Not necessarily, but I feel like a lot of the questions can be answered on the parent survey. So when we talked about devices, we talked about your choice in cohorts, um, internet access, all of that is also reiterated in the parent survey that you're going to get this evening. And so once we have answers from you, we'll be able to, respond appropriately.
Okay.
And Ms. Tiffany Johnson, did you see this request for a call?
Yes, ma'am. Ms. Washington, I'll be reaching out.
And there's
will the younger children be forced to wear the masks in class? And so, of course, we're not going to force a young child to wear a mask. We don't want to traumatize. It's already going to be a weird situation for our young children. We don't want to traumatize anybody. We're going to encourage and, as best we can, help them to see the importance of keeping the mask on. But we would not force a child to wear a mask.
How do you plan for the students who are doing 100% distance learning to get the same experience as being in the classrooms?
So as I said, I talked about briefly, our plan is for the children who are at home to log in to the classroom for classroom instruction. So the teacher is in the classroom with the 10 kids who are there for that day, and anybody at home will then log in and they will see exactly what the teacher is instructing those 10 who are in the room. So they'll be receiving the exact same instruction, and then they will be given follow-up activities to do on their laptop or on their tablet.
And so there's a question here about a parent opting for 100% virtual learning after possibly, some exposure or, that potential that they have with increased exposure to the flu-like symptoms during flu season. And so the short answer to whether or not a parent who has chosen option A or B to then go to 100% virtual, that's totally doable and that's totally your choice. We would just need to make sure that the school is aware of your choice to now have your child take advantage of our 100% virtual learning option.
Someone asked about the meals. The meals will not be hot. That is one of the big downsides of a bagged lunch. We're not going to be able to provide hot meals this year. We don't have. There's some food service caterers who do have the
prepackaged meals
that you put into like this warming oven. But unfortunately, the vendor that we have this year does not have that capacity, and so they are going to be bagged lunches that will not be hot.
So someone is asking about a school supply list.
So glad you asked that. So it's our plan to try to provide as much as we can for parents so that you don't have to go around and buy a whole lot of stuff, although we really, really, really would love it if you could buy a laptop or a tablet for your child. But we know we have a lot of generous parents at ECA. Over the years, you all have given us so much stuff that has really helped us. And we wanted to create a way that if you want to donate some things that we're going to need, that you can. And so we haven't put that together, but the plan is to reach out to you and say if you want to donate, some packs of pencils or some packs of crayons or whatever, then we'll have a way for you to drop it off at the school. So that'll be coming up shortly. But in terms of a supply list that you will need for your child at home, it's our intention to provide everything that your child is going to need at home, put it in a tote bag, and you will take it home and you will keep it at home for use for the distance learning days.
Will students be penalized for not having perfect attendance?
I'm not sure what that means.
Maybe that is in response to when I talked about the synchronous learning, about how we are going to be taking attendance. um, with the children, by the children being logged on at the time that the learning is taking place, maybe.
Right.
So the Office of the State Superintendent of Education has mandated that we have a system in place for taking attendance during this learning. So you will not be penalized, but the expectation is if you're participating in 100% virtual learning or virtual learning on 3 days a week, that on those days you still are your child is still logging in, and we still take attendance because that will be counted just as it's counted in a normal school year. So when you get your child's report card, if they missed, 10 days of virtual learning, that will be counted as 10 absences.
And our attendance policy will look very similar to what it has in the previous years, in that, we're going to, as Ms. Everett said, capture it every day. There will be follow-up phone calls for children who are not in attendance, whether that be on-site or virtual. And we have an attendance officer who responds to parents and tries to work out a plan for parents to increase attendance, and we try to put some supports in place if we should see some chronic absences. But the best way I would say for you as a parent to ensure that your child has good attendance is you have to remain in constant contact with us regarding each situation in your home, because this is very different. This is not them showing up to the school building. This is, for the most part, especially even if they are choosing cohort A or B, they're 3 days at home. And so it's going to be that communication with the school is going to be really, really important to inform us about what's happening so that your attendance will reflect, your child's participation each day on these platforms. But in terms of what we count as absences and tardies, it will be very much like what we have done in previous years.
So there's a question, if there is a case of COVID with staff or children, what has been put in place? And I'm not sure if we've answered that specifically, but if a staff or student is diagnosed as positive, we are, of course, that child is quarantined and not permitted back in the building until we receive a doctor's clearance. We are required to contact the city at DC Health, coronavirus at dc.gov, I believe is the site, and let them know that we do have a positive case at the school. They will then reach out to us to guide us on what we are to do next. It might involve quarantining the entire group with which the child or staff person came in contact. So if you have a group of 12 in a classroom and one person in that classroom tests positive, it might require that the entire group then be quarantined at home for a period, I believe, of 10 days or 2 weeks, just as a precaution. But these are guidelines that we will be given and then we will be mandated to follow. So someone asked, will there be an opportunity for the child parent to meet the teacher in person or virtually before school starts? Did you guys answer that one already? So yeah, I think that's a great idea. We would probably do it virtually, but certainly I think it's an excellent idea, and I think it'll alleviate some of the anxiety that the children are feeling if we can connect the child with the teacher before school starts. So we will definitely make sure that happens. I think someone asked questions about services to a child with an IEP. Did we answer that one? Anybody know?
What was the question?
Someone had
There
asked
was a question about a child if they I don't know if it had to do with an IEP necessarily, but it was talking about a child who struggles and what kind of, supports are in place for a child. It sounded like it might be a kid that might have an IEP,
Well,
but they just need
one
to know
question I read
how they're going to be supported.
there was one question I read that was specifically about services to children with IEPs.
Okay.
May have been another one about just a child who may be struggling. So what I know what Tiffany Johnson is trying to do is to ensure as much as possible that services to children with IEPs are held in person, and that they may not all be able to be held in person, but as much as possible, when that if the parent chooses either the Monday, Tuesday, or the Thursday, Friday, we're going to attempt to make sure the services are provided on those days when the child is on site. Now, that being said, there may be times when services will be held virtually, as they were this summer during extended school year, summer school for children with IEPs. But we do understand that it's much more effective for services to be held when the child is in the building. For strugglers, we are going to continue to have our response to intervention model that supports those children who may be struggling in reading or math, and that's an extra layer of practice and support beyond what they would normally get at that grade level. And that's something that the directors can talk more with you about as the school year progresses. Did we get everything? So there's the chat, and then there's the Q&A. We get both.
Yeah, I've been going back and forth.
So a couple of people are asking about how do you know which day. So again, when you do your survey, the days you prefer, either Monday and Tuesday or Thursday and Friday, and as much as we possibly can, we're going to try to honor what you have said you prefer. Or if it doesn't matter, you don't have a preference, please put no preference. That'll make it easier for us. We try to organize this. Someone asked, will my child have the option to warm in the microwave? I really can't guarantee that because our staff is going to be so involved in other things that have to do with health and safety. I can't really guarantee there will be somebody that can take food and go warm it up at lunchtime. I will say there are lots of variety that we can provide with cold lunches, and when I was a child, all my lunches were cold, but I guess things are different now.
Another option is to, if you are able to purchase one of those thermoses, you can send warm food in a thermos that will last about 8 hours. I do that for my own kids, and so that's a really good way to provide a warm meal if you wanted to send your lunch with your kids.
That was a much better answer. Thank you.
Current.
Somebody said this is too much. I agree.
It is. It is.
We all agree.
It is.
Oh my goodness. It is way too much.
It is.
Okay, so we did all the Q&As as well?
Yeah, I think
that we did.
And then what we can do is, if there are any questions that we haven't, because we will have access to the questions, and we'll look back at the chat feature, and if there are any questions that we haven't addressed, we will make sure that we address those with you.
Okay, so someone asked about a recap. I think, as Mr. Ingram mentioned earlier, this will be posted on YouTube, and we'll send you the title to pull up so that you can review the entire meeting at your leisure. I did want to add before we got off of this call. Oh, somebody said water bottles. We decided against water bottles because we were concerned about keeping them clean. And so what we decided to use instead are disposable paper cups, and just give the child a cup, drink water, throw the cup in the trash. So this year, as you know, Mr. Ingram has been our principal for how many years? 10 years? 5? I don't know. 10 years.
Yes.
10 years, right? And he is still our principal. Let me preface what I'm about to say with that. He is still our principal, but he is right now experiencing some medical challenges, personal medical issues and his doctor has required that he not come into the building when the children return. He said it's not going to be safe for him right now with what he is experiencing. And so for that reason, he will still serve as our principal, but he will serve in a remote capacity only. He will still have many, many things that he's going to be responsible for, but he's he's going to be fulfilling those responsibilities remotely. That being said, we need an on-site principal because our kids will be there 4 days a week. And so Pamela Falcon, who has been our director of curriculum and instruction, will be our interim on-site principal if we ever get back on site. So just wanted to let you guys know that, and we'll give you more details about that as time moves on. But certainly, if you have questions about that, you can shoot an email to Mr. Ingham, to Ms. Falcon, or to me. You think we've hit everybody's question?
I think we've answered. I think there are some that I did not read out because they were answered in other ways, and so parents don't feel like your question was ignored. If it was addressed in Ms. Edwards' presentation or in answering someone else's question, then we covered it.
Okay, somebody clarified about the hats, and she was saying because of the plastic, will it be swinging back and forth? It doesn't really swing a lot, and honestly, the kids are not going to be playing in the normal way we expect kids to play because even when they're outside, we're going to require some social distancing, so they're not necessarily going to be even close enough to one another for any kid to run and accidentally or on purpose hit another child. So I don't believe that would be an issue. In terms of bringing your child's own water bottle, that's okay, but I would encourage you to just let us use the paper cups, and I'll tell you why. If the child has a water bottle on their desk, it becomes all consuming to the child. They just want to drink water like all the time. And they just get really focused on the water and the water bottle. And so I think if we just take breaks and let everybody drink water, throw the paper cup in the trash, it probably would work out fine. Okay. We will reach out to you again about the devices if you cannot afford to buy one, so don't worry about that. Just hold tight. Someone asked about online tutoring for the third grade. Online tutoring for the third graders. I don't know. I'm not sure what that question means, the online tutoring. They're asking, are we continuing to use Dojo? That's a yes. Yes.
Will there be a PTO?
Somebody said they could purchase cups for the classroom. Thank you. That was nice.
Will there still be a PTO?
Yeah. So Miss Mayfield will work on getting us up and running again with our parent engagement committee. And perhaps with it being virtual, we could even get more parents involved because it won't require you to have to come out. You can do it just right from your home. So yes, we definitely will. Okay. Does anybody have any parting words you wanna provide? Okay, well.
So I wanted to follow up to the, because you know that fell out there where I do have, as she said, these health challenges. I anticipate that they are short-lived, and that I will return. And my plan is to come back to ECA in full health and back in the position that I held for the last 10 years. I'm looking forward to it. I'm not gone, so I'm still around. You see me virtually. You can access me through email or phone call. And I'll still be around.
Yeah, we've been working together for a long time. I can't do this without Ingram around, so he's gonna have to be around. Okay, we want to thank you guys for hanging in here. We've been on this call for an hour and a half, so we really appreciate you staying. Well, everybody didn't stay. I see some people have dropped off. But
Thank you.
At the bitter end, thank you so much again. Reach out if you have any questions. We're going to try our best to answer them, and I know things will come up. And we will most likely have another meeting. Listen to the mayor's press briefing tomorrow. Because she's going to talk specifically about what she's recommending for all DC schools.
Yes.
Have a safe evening.
Thank you.
Thank you.
Thank you.